Ramzi is currently based in Ottawa, Canada. He's an infectious disease and vaccines expert and holds a diploma in humanitarian assistance from the Liverpool School for Tropical Medicine in the UK. Previously, he's worked before moving into emergency management with different INGOs such as the World Vision, Save the Children, the Red Cross, and the Red Crescent Societies. And this is really, I thought this was really interesting, Ramzi. You worked and managed different emergency response operations, including the 2014 Ebola outbreak in Guinea. And you worked on the disaster risk reduction in the Middle East and North Africa project.
Right.
Right.
Yeah,
okay.
In 2014, I was deployed to Guinea for the Ebola operation.
All right. So welcome to this. Thank you for being here. We're being joined by people across different countries as we embark on this. For everybody joining us, Ramzi is a program manager in the humanitarian and emergencies team with an international NGO in Canada, and he manages the Middle East and Latin America. Ramzi, I'm going to get straight to it before we take a few of our audience's questions. You know, coronaviruses, we've been reading so much about them, so much information about them, and so much information about COVID-19 every single day, just this plethora of information. Can we just explain facts from fiction? What are coronaviruses and how is this virus different?
Sure. Before I answer that question, I just have to make a small disclaimer.
Disclaimer, yes, go ahead.
Yes, that I'm just here on my as a personal interview, and I'm not representing my organization. So everything I say, my opinions are mine.
So we won't hold it against you. Okay. Okay.
Yeah, so coronaviruses, as you said, lots of conspiracy theories, lots of things being said. Coronaviruses are a big family of viruses, actually. They infect animals and they infect humans. The first human coronaviruses were discovered in the 1960s. And since then, we have now 7 coronaviruses that are known to infect humans. 3 of them are known, 4 of them are not known to the general population because they just cause the regular cold, just like about another 250 different viruses.
Right.
So,
and the ones that are known, I'm guessing, are the MERS and the SARS, if I'm correct.
The MERS and the SARS and this new
so tell us, how is COVID-19 different than the other coronaviruses?
Sure. So COVID-19 is the name of the disease. The name of the virus is SARS-CoV-2. So it's kind of like HIV and AIDS. HIV is the virus. It causes the disease of AIDS. This is the same. SARS-CoV-2 causes the disease of COVID-19. So COVID-19 is a new coronavirus known to humans. It was discovered in China in December 2019. And we have no knowledge of that virus before. Some studies have identified that it's coming from bats. And I have to say here, it's not bat soup. It's not because we eat bats
it's
that
not,
we get.
So what you're trying to say is that it's not a conspiracy theory, that it was man-made and sent out to we talked about this yesterday, sent out to, the conspiracy theories out there are a little crazy, sent out to destroy our elderly population to ease economies around the world. You told me that was one of the big ones, right?
And to pay less retirement fees, which is mind-boggling, really. I think we're giving humans too much credit than they deserve. We still don't have the technology to do that. And the virus has been sequenced like early on. We know the genetic makeup of the virus. There's absolutely no evidence that anything has been manufactured in a lab and spread into the community to do whatever goal it was intended theoretically to do.
So this coronavirus spread from an animal to a man, and then just much more easily spread than SARS and MERS. All right.
And this is normal. Sorry, this is normal. A lot of viruses do that, just like the bird flu, for example. It's found in birds, it mutates, it gains the ability to spread to a person, and then it spreads even further, and then it becomes easier for it to spread from person to person.
I want to talk about the mutation in just a sec, but why is social distancing important? How do we limit transmission?
So I'm going to take your question in 2 parts. First, you mentioned the 1 week that we've closed almost everything, and then why it's so important. So the virus has about 2 weeks of incubation period. What we're seeing today actually is not a reflection of new infections today. We are 2 weeks behind the virus. These are infections that happened before. So until we see an impact from the lockdown, we need 2 weeks before we see any impact, because within these 2 weeks, people who have been infected previously will start showing symptoms.
So the ones that are showing symptoms now have been infected a good week
before
or 10 days ago. All right.
Yes. So we still have another week to go before we start seeing any impact. And then it's also affected by the number of testing. I also don't know whether we are testing more today and yesterday than we were at the beginning of the week.
So far, the way that they've said it is anybody who has mild symptoms is usually recommended to self-quarantine and to stay at home. People who started showing respiratory problems are usually encouraged to go to the hospital. And you know, we're going to talk about this with the next interview that I'm holding next week about, you know, with an emergency and an intensive care doctor, and how they're handling it, and they're opening hospitals across Lebanon to make way for COVID-19 patients. But what I wanted to tell you and go back to what you were saying is that whoever is testing positive today, whoever's showing symptoms, was infected last week. And please, guys, keep your questions coming, because I'm writing them down and I will ask them as soon as he's done with his sentence. Sorry, I keep interrupting you. Go ahead.
No problem. So why is social distancing important? It's because this virus has the ability to spread quite easily, as we've seen. If it finds a host, it will infect the host, no matter what you're doing. So what we need to do is reduce contact between people, because it's a respiratory virus. It spreads by droplets. These droplets, you'll either inhale them if you're standing very close to other people, or they will drop on surfaces, and then you'll touch those surfaces, touch your face, touch your nose, touch your eyes, touch your mouth, and then you'll self-inoculate. So this is why it's very important for social distancing to happen, so that people no longer are in close proximity, and so the virus will have less chances of finding new hosts. The other part why social distancing is important, it's not just because of the ability of transmission, but it's also because of the capacity of the virus to cause severe disease. 80% of the cases require hospitalization. 5% about 5% require intensive care. These are huge numbers, because the virus is able to transmit to so many people. Our hospitals, or any country's hospitals, as we're seeing today in Italy, do not have the capacity to accept that number of the influx of patients at the same time.
And we were talking about this. Yeah, we were talking about this with the doctor previously. By the way, we just got information right now that Italy has registered in the last 24 hours. It had registered it 2 days ago, but it just registered it again in the last 24 hours. It has had the highest death toll ever recorded because of COVID-19. Out of all the countries, they stand at 793 deaths in 24 hours. What Italy is going through is heartbreaking. And could this happen to Lebanon?
I mean, if we do not take social distancing seriously, if you do not increase our testing capacity, if you do not increase our hospitals' capacities, this could happen maybe anywhere. I mean, I don't want to go into fear-mongering and speculations.
No,
but
we
need to learn from other experiences. And when we look at other countries in Europe, such as France and Spain, and the USA now, they are going into that exponential growth curve. So pandemics are also dynamic. So lots of different factors will affect how a disease behaves in different contexts. So we might not see the same exact behavior and dynamics in Lebanon, but we can easily overflow and overwhelm our health infrastructure.
Ramzi, this is a question that I kept getting when we talk about flattening the curve. Are we just buying time for scientists and researchers to find a solution? But eventually, when we all come out, isn't this just going to happen again? I mean, because we haven't really gotten rid of the virus. We're just flattening a curve.
Right. And Flattening the curve is really important. Time is really important in this case. This is a new virus, right? So we are discovering it as it infects more people and as it infects additional countries. We need to buy time. China, with the extreme measures that they took, bought the rest of the world several weeks for us to prepare. Some countries took advantage of that. Others didn't, because they didn't think that this would balloon to what it is today. But
all right.
buying time is important, because also science has never been faster than it is today. We've sequenced the genome of the virus within 2 weeks. It's been uploaded for international partners to work on it. Science is also happening as the virus is spreading, and science has never been faster either. So it's also important to note that. So yes, time is very important to buy until such time where we can develop treatments or get to a vaccine.
So we're gonna get to treatments in a second, because I know we spoke about this. The vaccine is gonna take a good year and a half. So a lot can happen from there to then. But another question that we're constantly getting is, you know, we know it's surface. We know that we can get it via surface, but as the weather heats up, there were contradictory statements. Could humidity, and we had one of our audience member ask this question, could humidity and the heat make this an airborne virus? Could we start catching it in the air?
So I've heard the opposite statements, where people were saying that the heat and the humidity will affect it in reducing the transmission.
Will it? We don't know yet. We're still figuring it out.
I don't think it will, because the virus has already spread in countries where it's hot and it's humid, and we have not seen any evidence that it's slowing down. It's still spreading at the same rate as other countries. And I think this is coming from the fact that the flu viruses react this way. Flu viruses do not like the heat. So when summer comes, you see the rates of flu just dropping down, and then it picks up.
But do you expect this one? But this one is showing no sign of slowing down. So what is it going to do? It's going to mutate. It cannot increase. What you're saying is it won't increase the number.
I'm not saying no. I'm not saying that. I'm saying that it will continue to spread the way it is now.
Right. Yeah. But it doesn't necessarily mean it's going to spread more or faster. It's just going to. I
haven't seen that. I haven't seen that happening in other countries. No.
Okay. All right.
Right now, I wouldn't be able to answer that question with a yes.
All right. So, you know, I want to compare it to other countries and where we are today. Where is Lebanon today compared to other countries? China just reopened its schools. Japan also. It's business as usual again. They have no new recorded cases. How far behind are we? So where exactly are we? Because everybody who's quarantined keeps asking this question of time. How much time? They said 2 weeks, but it's going to take longer. Where are we in terms of that?
So in terms of that, I think we're still at the early stages of spread. Lebanon has done a great deal of managing the spread. So until yesterday, we've never had exponential growth. We've only had linear growth, which is much better, much more manageable. Today, it will be interesting to see if tomorrow and the day after tomorrow, if this trend of exponential growth continues in Lebanon.
Right, right. And it looks like it will, right.
Yeah, I mean, we'll see. So how long, it's hard to say, but we need to remember, we can compare it to other countries. For example, South Korea. They did not go into blanket lockdown.